Keloid and hypertrophic scars. Both hypertrophic and keloid scars contain excess collagen. In hypertrophic scar, the collagen remains within the borders of the scar, but in keloid scar, it extends into the surrounding undamaged skin. Hypertrophic scars usually settle spontaneously, although they can take a few years and leave unsightly scar, but keloid scar persist. Hypertrophic scar is more common in young people, can occur any part of the body, and more common if there has been wound infection and breakdown or healing by the secondary intention. And these hypertrophic scars most commonly found at the joint and the skin tension lines. Keloid scarring may be familiar, such more common Afro-Caribbean than the Caucasian, and has predilection for certain part of the body, such as head and neck, ear lobule, and more rarely post-auricular skin. Treatment of keloid scarring is difficult and often unsuccessful. Patients find it difficult to believe that simple excision will not solve the problem, and keloid recurrence is not only inevitable but may be worse. Triamcinolone injections are the mainstay of treatment, although great care should be taken that steroids should be correct strength 10 mg per ml, not 40 mg per ml. This triamcinolone injection causes fat atrophy, and this fat atrophy takes 2 to 3 years to recover. Other treatment are steroid impregnated tape, topical application of hydrocortisone, pressure garment or pressure application by bandage, and pressure silicone sheet application, cryotherapy, radiotherapy, and laser treatment are the other options. This triamcinolone injection is available from 10 mg per ml to 40 mg per ml, and this triamcinolone injection should be given intralesionally every 1 month, 4 to 6 weekly interval over 6 to 10 doses.